we will review the proper patient preparation before beginning spirometer testing. Reliable and reproducible spirometry results with fewer repeats depend on proper patient preparation, coaching, and patient effort. You are the key to successfully guiding the patient through this testing process. In order to get good test results, it is suggested that the following patient pre-test preparations be followed. Measure the patient's height. An accurate measuring device should be used. If the patient can't stand for the measurement, measure their arm length from fingertip to fingertip while their arms are outstretched against a wall. Since FVC values are greatly influenced by the height of the patient, height should be measured to the nearest half inch. A sitting position is recommended during testing as it may be safer for the patient if they experience syncope or dizziness while performing the forced expiratory maneuver. If prior testing took place with the patient standing, you can perform a new test with them sitting, but make a note of the change. If a patient stands during testing, it is recommended that a chair with arms and without wheels be placed directly behind them in the event that the patient needs to be seated quickly. Ask the patient to loosen any restrictive clothing. If the patient has dentures, have them place them in a cup during testing. Use of a nose clip is highly suggested during the testing procedure. Avoid cross-contamination by disposing of each disposable mouthpiece and replacing it with a new one for each patient. Explain to the patient that they will be performing a minimum of 3 and a maximum of 8 testing maneuvers and always wash your hands. Now you are ready to give the patient the instruction they will need to perform a proper spirometry test. The accuracy of spirometry testing depends on proper patient instruction and coaching. After patient instruction is given, it is essential that the clinician demonstrate the correct way to perform the test. It is recommended that you explain the purpose of spirometry to your patient.
And the purpose of spirometry is to measure how much air you can take into your lungs and how much air you can blow out of your lungs hard and fast. It's kind of like blowing out birthday candles on a birthday cake, and we want you to blow out until you're all the way empty.
Next, using a mouthpiece for instruction, explain to the patient that they will be holding the mouthpiece up and to the side of their face and inhaling as deeply as possible. Then instruct them to quickly put the mouthpiece in the mouth with the tongue under the mouthpiece, teeth and lips around it, sealing the lips around the mouthpiece, and blast out as hard and fast as possible. Make sure the patient knows not to block the opening of the mouthpiece with their tongue or teeth. To emphasize that you are taking a deep breath, throw back the shoulders and widen your eyes. The correct posture during the test is to have your shoulders back, chin up, and don't lean or bend forward as you exhale. The normal tendency of your patient is to lean or bend forward while exhaling forcefully. Ask the patient for permission to place your hand on their shoulder during testing. If they start to lean forward, you can quickly and gently help correct their posture. Having a patient visually focus on something at eye level, such as an incentive screen, can help them maintain correct posture, which will result in better test performance. There are 5 incentive screens to choose from in the IQ Manager software. The IQ Spiro device is easy to grasp and control. However, your pediatric patients with smaller hands will have a much easier time holding the device with both hands. For pediatric patients, it is recommended to use an incentive screen to help them successfully complete the maneuver.